1st of December 2021. We have entered a new month, and it's a very busy month because then we have Carnival and then we have our Christmas season as well. It's a very festive month. We continue to update you and to bring you information with respect to the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. The pandemic is not over, and recently you would have heard that Omicron is the new COVID-19 variant, which means that the virus continues to reinvent itself, continues to have mutations. And so it is a stark reminder to us that the COVID-19 pandemic is not over. It is still with us, and we have to keep implementing all of the measures, those that are pharmaceutical and the non-pharmaceutical measures, to combat this very dreadful and elusive virus that has wreaked so much havoc in the world. So thank you very much for joining us. We are joining you at this time because, of course, there was the National Assembly today and it was just adjourned a few minutes ago. Nonetheless, we are happy to be here. We heard a lot of commendation going out to the Prime Minister, Dr. the Honorable Timothy Harris, on his 28 years as a parliamentarian. And we here at the National Emergency Operations Center also would like to wish the Honorable Prime Minister, a happy 28th anniversary of being a parliamentarian. Today, I would like to first introduce or to invite to the podium Dr. Cameron Wilkinson, our Medical Chief of Staff at the Joseph N. France General Hospital, to give us a presentation. Doctor.
Thank you very much, Lesroy. Today, I want to use my time to speak about the booster shot. Persons have been coming forward voluntarily for booster shots to give themselves extra protection against this deadly virus. As of this evening, we have administered boosters to 622 individuals. About 50+ persons have been coming forward per day since we started administering the boosters, with a record 93 persons getting the extra protection today. While many adults are coming forward for the extra protection, please be reminded that the vast majority of our children between the ages of 12 to 17 remain unprotected, despite the fact that a vaccine has been available for them for several weeks. We cannot choose to protect ourselves, but leave the children who are the future of this country unprotected. So I urge you as a parent or a guardian to give your child the best fighting chance against COVID-19, which is the vaccine. Many have been calling for extra information on the boosters, which I hope to provide today. First, what is a COVID-19 booster? A COVID booster shot is an additional dose of the vaccine given after the protection provided by the original shots has begun to decrease over time. The booster is therefore designed to help people maintain their level of immunity for longer. Who can get a booster? All adults 18 and over should get a booster. The oldest should make it a priority, as they are the ones most likely to have pre-existing conditions and to have the worst outcome if infected with COVID-19. When can the booster be given? If you are eligible for a booster vaccine, you can have it 6 months after your second dose, and no appointment is needed. You simply walk into any of the health centers during the time when they're giving vaccinations, and you can get your booster. Some persons ask, which vaccine will be used for the booster? You will be offered a dose of the Pfizer as the booster. Evidence shows that these mRNA vaccines work best as boosters, even if you received a different vaccine for your first 2 doses. So even if you had AstraZeneca for your first 2 doses, you will be given the Pfizer as the booster. If you had the 2 Pfizers for your first 2 shots, you will be given the Pfizer as the booster. How effective is the booster? A real-world study shows that boosters significantly increase protection against illness from COVID-19. The study found that 2 weeks after a booster dose, protection levels increased to 93.1% for those who had AstraZeneca as their first 2 doses and 94% for those who had Pfizer. How long does the booster take to work? Some persons ask. Studies have shown very high protection 1 to 2 weeks after the booster jab. As a matter of fact, a recent trial by Pfizer suggests that from 7 days onwards, a booster dose of Pfizer is extremely effective in preventing illness from COVID-19. Some persons ask, can I have a booster jab if I've recently had COVID-19? If you've tested positive for COVID-19, you need to wait at least 28 days from the day that you were last tested positive before you can get the booster. And the gap is there to separate any side effects that you might have from the vaccine, from any residual effects that you were having when you were infected with COVID-19. Some persons might ask, why might I need a booster? The booster vaccine is recommended in order to give longer lasting protection against the virus. The protection from vaccines may start to reduce 6 months after vaccination. This doesn't mean that the vaccine stops being effective after 6 months. The vaccine works extremely well and offers a very high level of protection. So a reduction in the efficacy doesn't mean that you're not protected at all. What it does mean is that a booster will give you a higher level of protection, and this extra protection is even more important as we have new variants circulating. Persons ask, what is the difference between a 3rd dose and a booster dose? The main difference is in the reason why it is given. If you are immunosuppressed or immunocompromised, which means that you can't mount a proper immune response, you will be offered a 3rd dose of the vaccine to increase the immediate level of protection you get from that vaccine. This is because you will not have a strong enough immune response after 2 doses. And this is generally given 8 weeks after your 2nd dose and is part of your primary vaccine program, and so it is not considered a booster. On the other hand, a booster vaccine is offered to all adults because we know that the immunity from vaccines can wane over time, and so it is to boost your level of protection. Some persons ask, will I get a booster vaccine every year? The current advice on boosters is for the upcoming months. The situation will be kept under review depending on what happens with COVID-19. It's possible that a COVID booster jab will be offered every year like the flu jab if the virus continues to circulate and mutate. And if persons continue to refuse to come forward and be vaccinated, the virus will continue to circulate. We can see more variants developing and possibly use almost every single letter in the Greek alphabet to name these variants, but we are not helpless. We can put a stop to this by coming forward, getting vaccinated so that we can stop the spread of this virus and therefore arrest the mutations. Some persons ask, can the COVID-19 booster be given at the same time as the flu jab? Because we know that there's some persons who are going forward now to get their flu shots. Yes, the flu shot and the COVID-19 booster vaccine can be offered at the same appointment. Now, thanks to social distancing and other measures, we did not have a significant flu season last year, but there are a lot of persons now who would not have the necessary protection because every year when the flu comes around, you get some degree of protection. So those persons who normally take the flu jab, you can go forward and get your jab, and there is no contraindication to you getting the booster at the same time. Some persons ask, what are the side effects from the booster? Some people will experience mild short-term side effects after having their booster, And these side effects are similar to those from the first 2 doses, including pain at the injection site, heaviness at the arm, a little headache, feeling tired, achy, or just some mild flu-like symptoms. Some persons don't have any side effects at all, and these symptoms don't last for more than 1 to 2 days. And so I am pleased to see that our adults are coming forward in their numbers voluntarily to get their booster shots to give them an extra protection. But these same adults who have come forward to get 1 shot, 2 shots, 3 shots, these same adults who have carried our vaccination coverage among our adults to over 80.3%, these are the ones who are responsible for the children in our society. And we see that the vaccination coverage among our children, it is still in the low teens. And so I want to ask you, if you have done what's right for yourself, do what's right for your children, and bring them forward to be vaccinated so we can all be protected. Thank you.
Thank you very much, Dr. Wilkinson, on your presentation on the importance of getting vaccinated. I want to now invite Superintendent Cromwell Henry to give us an update on the regulations pertaining to the COVID-19. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. We continue to see easing of restrictions as our COVID-19 infection rate remains consistently low. Current emergency powers regulation will expire on December 2nd. On Friday, December 3rd, when new regulations are published, we shall see a further easing of some of the COVID-19 restrictions. Some of the restrictions to be eased will include restrictions on social activities. I must warn you, however, that with the new regulations, with the new developments surrounding the new COVID variant, we have to proceed with caution to minimize the risk of infection. We will therefore require persons attending events to continue to adhere to the COVID-19 prevention measures such as good hygiene and sanitization behavior and the wearing of face masks. The new regulations will also add another layer of protection by requiring organizers of events to ensure that only vaccinated persons are permitted entry. It therefore means that patrons entering these events will be required to present a valid government ID and their vaccination cards at the point of entry. The number of persons permitted to attend events and patronize bars will also be increased to 75% of the normal capacity of the venue. This capacity will be determined by the compliance team or the fire department, who will visit the establishment and conduct an inspection. The new procedures will apply to mass events and will also be laid out in the new regulations. We therefore ask that organizers familiarize themselves with the new procedures and other provisions relative to events when the new regulations are published. As we transition to this new paradigm, we ask for your patience with the process, always keeping in mind that we are still in a pandemic, and we have to ensure that whatever we do is done in a measured way, keeping in mind public health and safety. Thank you.
Thank you very much, Superintendent Henry. Of course, you know, the message does not change from day to day. The protocols remain the same to keep us safe. I now invite our Chief Medical Officer, Dr. Hazel Laws, to bring us the most up-to-date Health Emergency Operations Committee report for today. Dr. Laws.
Thank you, Mr. Williams, and pleasant good afternoon to everyone. So in the Federation, we've been responding to the COVID-19 pandemic for almost 2 years. As you are aware, we have now contained our third wave of infection, third wave of COVID-19 infections. We've been battling this wave from about mid-August to present. Now, over this past week, we've only identified 12 newly diagnosed cases of COVID-19. During this same period, we've only had 1 hospital admission, 2 individuals were discharged, and we continue to enjoy an excellent recovery rate with 68 persons recovering within this past week. This slide provides a snapshot as to where we are in terms of our COVID-19 response. So to date, we have reported a total of 2,786 confirmed cases of COVID-19, with 2,320 of these cases identified on St. Kitts and the remainder on the island of Nevis. Now, again, as I said before, we continue to enjoy excellent recovery rate with 2,740 individuals recovering nicely. So that leaves us with 18 cases. So right now we are only monitoring 18 active cases, 7 on the island of St. Kitts and 11 on the island of Nevis. In terms of COVID-19 related deaths, we've only reported 28. And it's with pleasure we say that we do not have any cases in hospitals. So there are 0 admissions in terms of COVID-19. This provides you some demographic data related to the deaths. So 86% of the individuals who died were unvaccinated, and the majority of them were 60 years and over. And so I want to use this opportunity, as I have each week, to reach out to the older adults in our population, those who are also diagnosed with other chronic illnesses like diabetes, hypertension, heart disease, kidney disease, etc., even asthma. We really want you to come forward and accept the vaccine, because if you are not yet vaccinated, you are vulnerable. Just yesterday I heard there's this young lady applying for a job, and she had an interview, and she's diabetic, and her story is that she's not vaccinated because she's diabetic and on insulin. And I said to myself, if she's diabetic and on insulin, she's vulnerable, because if she were to contract the disease, her risk, and she's obese, so she's unvaccinated, diabetic, on insulin, and obese, so she would be at risk for contracting the disease and at risk for moderate to severe COVID. So I want to reach out to older adults with NCDs, chronic non-communicable diseases, diabetes, hypertension, asthma, heart disease, liver, kidney disease. Please, we want you to recognize your vulnerability and come forward in terms of accepting the vaccine, because that's the best protection that you have. Because if you are unprotected, you're vulnerable and at risk for severe COVID if you do get COVID. This slide just provides information regarding the 2,786 cases. 70% of the cases were not vaccinated. 6.9 or 7% partially vaccinated. So yes, if you are unvaccinated, you are at risk of COVID. We now have a new variant on the horizon. It's a new kid on the block, and we want you to come forward, recognize your vulnerability, and protect yourself. That's the best weapon we have to date. So we continue our vaccination program, and to date we've achieved the following coverage rates. whereby 80.2% of the adults in our population have come forward and received the first dose. And this is a threshold that we highlighted a few months ago, and we have attained it. 80.2% of the adults in our population have come forward and received the first dose. 73.8% of the adults in our population are fully vaccinated. They have received 2 doses. And as you are aware, in September, we started administering the Pfizer-BioNTech vaccine to our teenagers 12 to 17 years. 14.2% of these teenagers have come forward already and received the first dose, and 11.9% are fully vaccinated. So again, I want to use this forum to reach out to parents and guardians of the teenagers. So we wanted to empower yourselves in terms of the facts about the Pfizer-BioNTech, its safety, and we wanted to come on board in providing consent for your teenager to be vaccinated, because in so doing, you will be facilitating ensuring safety in our schools, such that our children can continue face-to-face learning, because some of the children, they are not doing well in terms of online tutoring. All right, so this slide provides a disaggregation of the data by island, and so you can see that in St. Kitts, 84.8% of the adults have received the first dose. In Nevis, 68.2% of the adults in Nevis have come forward in terms of accepting the first dose of their COVID-19 vaccine. And then you could see 73.8% federation percentage or coverage rate in terms of the adults being fully vaccinated. St. Kitts, 77.1, Nevis, 65.0. So this slide just shows the data, the disaggregated data by island. All right, so Dr. Wilkinson provided you a presentation about the booster shot. I just want to say that the booster shot is available to all adults or persons over 18. Once you would have received the first vaccine series over 6 months ago, and you can come forward and request your booster shot. Just walk into any health center, make your request, and you are good to go. All right, so our Prime Minister would have announced these new measures earlier today in Parliament, and so I just want to underscore what he said. And so as of Friday, the 3rd of December, all vaccinated tourists who are arriving by cruise, so all cruise passengers who disembark, and all layover passengers at our hotels who would have completed their 24-hour quarantine, they are free to go to any of the tourists, the COVID-19 approved attraction sites and beaches. So let me repeat, all vaccinated tourists, meaning those arriving by cruise or by air. Let me just add, if you have arrived by air and you are staying at one of the hotels and you completed your 24-hour quarantine, so in other words, you would have done that test on arrival within 24 hours. If that test result is returned negative, you are then free to go to any of the approved tourist or attraction sites or beaches. And so both can mingle, the cruise passenger and the layover passenger who would have completed their 24-hour quarantine. The second measure speaks to the unvaccinated or partially vaccinated inbound passenger. The quarantine period is now reduced from 14 days to 9 days. So if you are coming into the Federation and you are unvaccinated, so at present, it's only our nationals and residents who qualify or who can return home unvaccinated. And so if you are an unvaccinated national, returning national, or partially vaccinated, meaning you only have one dose on board, you now qualify for a 9-day quarantine period. And thirdly, entertainers will now be able to undertake mass events for fully vaccinated patrons with 75% space capacity. Superintendent Cromwell Henry spoke to this in his presentation. Okay, so I just wanted to remind everyone about the 4 variants of concern, or the original 4, meaning the alpha variant, the beta, gamma, delta. We now have a 5th, Omicron. Okay, so in the region, in the Caribbean region, this is data coming out of CARPHA, we have these 4 variants of concern in circulation. So we have the gamma variant, 39% of the samples they've processed to returned positive for gamma. The alpha variant, 15%, and delta variant, 36%. There's the lambda and there's the mu. And there's also beta, but a smaller percentage. So all 4 of the original variants of concern are in circulation in the region, in the Caribbean region. I also want to underscore that as we speak, the Delta variant is the most prevalent variant in circulation globally, the Delta variant. It's highly contagious, and unvaccinated individuals are at risk. And the COVID-19 vaccines remain the best weapon or the best protection against the Delta variant. Omicron. All right, so there's a lot in the news about Omicron, which is the latest variant of concern. It was highlighted or brought to the fore by the World Health Organization on Friday, November 26. So it's a variant of the SARS-CoV-2 virus. Now, this variant has a large number of mutations or changes. A significant amount or number of these changes have been noted in the spike protein. And this is important because it has implications in terms of the effectiveness of the current vaccines. Now, some of these mutations noted in Omicron is also common to the alpha, beta, gamma, delta, and lambda variants. That's important to note also. Now, I attended a regional meeting, a CMO's meeting about 2 hours ago, and they shared this bit of information. Anecdotal evidence so far suggests that the symptomatology, or there's a little difference in the symptoms with which the patients are presenting. Some complain of significant fatigue, itchiness of the throat, dry cough, and muscular pain. Not too different, but some differences. Now, it's important to note that the first known sample of Omicron variant was collected in South Africa on November the 9th. However, today in the New York Times, it was stated that Nigeria's Public Health Institute detected Omicron variant in a test sample as early as October of this year. So in essence, the scientists still cannot say for sure where and when this variant originated. But what we can say is that throughout the day, CNN tells us that the variant has already been identified in over 23 countries so far. Okay, so what's the latest information about some of the characteristics of this variant? Well, the scientists and much the world is still ignorant about the facts pertaining to Omicron. So in terms of transmissibility, it is still not yet clear whether Omicron is more transmissible than the other variants, including Delta. In terms of severity of the disease caused by this variant, it is not yet clear whether infection with Omicron causes more severe disease compared with the infections caused by the other variants, including Delta. However, anecdotal information coming out of South Africa suggests that those patients are complaining of mild symptoms. But then there is some other anecdotal information suggesting that it goes across the continuum, mild to severe disease. So it's early yet to determine the severity of the disease caused by this variant. In terms of Omicron's impact on the countermeasures, including vaccines, we are still not yet sure as to how effective the current vaccines are with respect to this variant. So this scientific information is still being studied. In terms of testing, the big question is, would the current RT-PCR tests detect this infection or infection caused by Omicron? And the answer is yes. So far, the RT-PCR tests continue to detect infection with Omicron. But again, more work and more studies are being conducted with respect to the other types of COVID tests and their effectiveness in terms of picking up infection caused by Omicron. I suppose they're looking at the sensitivity and specificity of the rapid antigen tests being used to detect Omicron. So again, we await the scientific information. Treatments, so far, the corticosteroids still remain effective in terms of managing patients with severe COVID. Again, work is ongoing in terms of the various treatment modalities for patients who are diagnosed with Omicron. So what are the concerns? What are the main concerns about this variant? All right, so previously identified mutations found in this Omicron variant have shown potential for increased transmissibility, potential for increased disease severity, and probably a reduction in the effectiveness of antibodies that your body would have produced either naturally or vaccine-induced. Early modeling suggests that Omicron may be as much as 100 to 500% more transmissible than the original strain. But again, this scientific information has to be confirmed or is yet to be confirmed. However, in South Africa and those southern African countries and further afield, there are reports, anecdotal reports coming out of reinfections and breakthrough infections of vaccinated individuals. But one thing we know for sure is that there's a very high risk of this variant being imported to the Caribbean. So we need to be cognizant of this because of the expansion in terms of tourism and flights coming into the region from Europe, the Netherlands, for example. There's a very high risk of this variant being imported to the Caribbean. And so this variant fueled concerns and fear, and it sparked a wave of travel restrictions. However, we want to underscore that the scientists are still seeking additional information about this Omicron variant. We are still ignorant about this Omicron variant, and so we do not have enough information in terms of following suit with a travel restriction, and so that recommendation was not made. WHO recommends that we increase our public health and medical capacities. In other words, increase and augment the healthcare system and prepare ourselves for a surge in cases. We need to continue the COVID-19 prevention and control measures. We need to enhance surveillance, and we need to make sure that, the appropriate samples are sent for genomic sequencing. We need to, the world needs to address the inequality in access to COVID-19 vaccines. And most importantly, we need to enhance border surveillance. And so we need to be able to pick up Omicron as soon as it appears at our shores. And so border surveillance, critical. And so that's why the vaccinated inbound passenger, will be required to do the 24-hour quarantine and test before they are released and be allowed to integrate into society. For now, until we get more information, until we glean more information regarding this Omicron variant. It's all a part of border surveillance. WHO recommends that we enhance border surveillance, and so that's why this measure is maintained for an additional week or two until we get additional information regarding this variant. Today's World AIDS Day. The theme: end inequalities, end AIDS, end pandemics. Broad objectives. What I want to focus on or zero in terms of our federation on today, World AIDS Day, is I want to speak to our pregnant females. It's imperative that once you're a female, once you've been, confirmed pregnant, we want you to access antenatal care as soon as possible. So once you find out you're pregnant, please, we want you to go to the nearest health center or to your OBGYN and start and book for antenatal care. And it's important that you keep all your antenatal appointments. And so when the nurse at the health center tells you to come back on such and such a date, it's very important that you keep that appointment. When you go to your OBGYN specialist, it's important for you to keep your appointment. And all pregnant females, you are required to do your antenatal screening tests for HIV, syphilis, hepatitis B. You are expected to do your hemoglobin and blood group. These tests have paramount importance, and so once you're a pregnant female, if you have not yet gone to do your test, please go and make sure you are sent to do your antenatal screening test. And it's very important because if you are HIV positive or positive for syphilis, treatment is its key, meaning treatment for you, the seropositive mom, and treatment for your unborn child. So it's very, very important that you keep your antenatal appointments to ensure adequate treatment. And of course, the last bullet point, if you're pregnant, you are expected to book for delivery at the Maternity Wing, JNF General Hospital, Maternity Wing, Alexandra Hospital, and this must be done at 28 weeks gestation. And so today, World AIDS Day, I want to speak specifically to pregnant females, the importance of getting antenatal care, the importance of doing your antenatal screening, the importance of attending and keeping all your appointments. And if it is that you are to be treated, make sure and ensure you follow through with your treatment, and you are to book for delivery at 28 weeks gestation. The COVID-19 protective measures. We need you to empower yourselves in terms of the information regarding the COVID-19 vaccines. If you are not yet vaccinated, we want you to come on board, especially the vulnerable amongst us, meaning the older adults with chronic non-communicable diseases, those who are in nursing homes, those who are in the prison. we want you to come forward and accept the vaccine. Wearing of the face mask is of paramount importance even now with this new variant on the horizon. We want you to maintain adequate hand hygiene and adequate distance from others. And if perchance you're experiencing any of the COVID-19 like symptoms, we want you to stay at home. Thank you.
Thank you very much, Dr. Laws. Hearing you say that the Omicron was detected much earlier than it was reported, I think that South Africa must be commended for reporting it. Because if it was detected by other countries and they did not report, then South Africa is really to be commended. But instead, as we see, South Africa is bearing the brunt of travel advisories and things like that by other countries, and it's very hard on them, for being honest. I want to invite Mr. Abdias Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, to give us his presentation.
Thank you, Mr. Williams. And I love your mask that matches with your shirt, you see. Right. A pleasant good evening to all those who have joined us via the various means. First of all, I want to start this presentation by thanking God and thanking all our stakeholders, partners, whether regional or internationally, for supporting the National Emergency Management Agency over the past 2021 Atlantic hurricane season. As we have experienced, we have seen how devastating these cyclonic hazards are. However, St. Kitts and Nevis, again, we have been spared. We have not had any significant impact or damage by these by these threats in the Federation of St. Kitts and Nevis. Again, I want to thank the Christian Council Evangelical Association and every single citizens, resident, and all the well-wishers in the diaspora and around the world who have prayed for the safety and protection of the residents here and this beautiful federation. So again, as we come to an end of the 2021 Atlantic hurricane season, as the National Disaster Coordinator, and I am certain on behalf of my staff, we say thank you to you for all that you have done in preparing for and also in helping us to mitigate the impact of hurricanes or any type of tropical cyclones. So again, thank you very much. However, please do not become complacent. Historical data has shown whereby we have been impacted by hurricanes or tropical storms or heavy rainpours during the month of December. So again, let us remain steadfast and continue to pray. I want to continue my presentation by alluding to several logistical discussions that the National COVID-19 Task Force would have had over the past week. First, I am pleased to announce to you, the general public, as well as the world at large, that St. Kitts and Nevis would have had a travel ban on Brazil. And the recommendations of the National COVID-19 Task Force, the Cabinet has accepted the recommendation to have this ban removed from Brazil effective December 2nd. So we are pleased that now citizens of Brazil can travel to St. Kitts and Nevis once they meet our health and travel protocols. I now want to bring to your attention also the process that we attempted to implement as of the 1st of December. So the intention was to have, as of the 1st of December, the land and go process implemented. What did that mean? That means that all inbound passengers who would have had the negative RT-PCR test 72 hours prior to boarding the aircraft to St. Kitts and Nevis and being fully vaccinated, meaning 14 days must have elapsed after the second dose, would have been allowed to enter the Federation once granted approval by the Ministry of National Security, and then would have gone through the border management agencies, and then would be allowed to integrate into society without any quarantine, any testing. Please be advised, as the CMO would have indicated, that based on the risk associated with the variant Omicron, the Cabinet was advised and accepted the recommendation that was brought from the HEOC to the Task Force, National COVID-19 Task Force, endorsed by the Task Force, taken to the Cabinet yesterday, and this was accepted for us to delay the implementation of the process. The process has not been made obsolete, it's just a delay, so that we can give our health authorities, our science experts, the opportunity to get further information on the Omicron, so then we can proceed and make an implementations. I just wanted to make that clear because I have been getting a lot of queries about what was stated by the Honorable Prime Minister. So what was stated by the Honorable Prime Minister does not change the existing protocols. It does not change the existing health and travel protocol. Those have not changed. The only thing that has changed is one, you will see, whereby the stay-over passenger, once they have cleared quarantine and they are free to integrate, they can now mix with the cruise passengers at the touristical sites or attractions such as beaches, Brimstone Hill, Black Rocks, and some of these areas. Okay, so that's what the intention for that statement. And then Superintendent Henry would have spoken to the entertainment section. So the entertainment section, that was something that was approved, and you can apply to the through the police portal for these permissions, bearing in mind that terms and conditions are attached to these applications. So those are some of the significant changes as outlined by the CMO. So I just want us to get this clear, that these recommendations are being implemented as of the 3rd of December. So also we want to inform you of some of the other discussions we would have had regarding to Carnival and other discussions we would have had regarding to sport. Tomorrow, the National COVID-19 Task Force will be meeting with the ICC and the local organizing committee for the cricket regarding the hosting of cricket in St. Kitts in the near future. That meeting will happen tomorrow. Equally so, the task force would have done a walkthrough of the airport. And the airport we would have done a walkthrough to see how best we can make the entry process and the processing for inbound passengers much more efficient and much more faster. So yes, we have heard the concerns of the hoteliers, we have heard the concerns of our citizens and also some of the guests. And we are, at the present moment, the process is being reviewed. Tomorrow, all the border agencies will be coming together to discuss the process some more and to see whereby we can eliminate the long period of waiting. However, I just want to make this clear for you. Yes, we want changes. Yes, we are ready to absorb some more risk. But let me just notify you of this. We're going to have 3 critical barriers to help us in buffering the protection against the COVID-19 virus once we implement the land and go process. One is going to be the verifying process where we have the technicians from health, the Ministry of Health, Immigration, Customs, and National Security verifying that entry process. That entry process is our first tier of defense. The second tier of defense is the port health surveillance that the CMO would have addressed or alluded to in her presentation. That's the screening process that you will go through when you arrive at RLB International Airport or the Vance Amory International Airport. So I'm appealing to persons for patience and understanding and cooperation when these technicians attempt to process you. So they are verifying that your test is correct. They are verifying that your vaccination card is correct. We have experience whereby what is sometimes uploaded is not exactly what sometimes persons present when they come to the portal screening desk. So that process is going to take place. That's our second tier of protection. Our third tier of protection is the airline itself. The airline has a responsibility to ensure that for you to board that aircraft, you must have the necessary approvals as required by St. Kitts and Nevis. Those are the federal laws of St. Kitts and Nevis. That's why you see them in the SR and O's. Those are statutory rules and orders. Let me just state, for the month of November, we would have had 108 passengers brought to the Federation of St. Kitts and Nevis by airlines, by major airlines, regional airlines, into the Federation of St. Kitts and Nevis without appropriate approvals. And that challenges the Federation. The virus can be imported through these challenges because then these individuals were not screened through the process that's in place to help us combat the virus and help us to give you some more easement on the restrictions. So we are looking at ways and means to collaborate more with the airlines so that they can help us in the fight against COVID-19 to manage the border management challenges that we are facing worldwide. Okay, so these are some of the things that is important for you, the general public, to know so that you yourself can help us in the all of society approach to combat and manage, mitigate the impact of COVID-19 if we want to see the restrictions lessen more and more and more. So I wanted to bring that to your attention. It's important for you to be cognizant of what is happening and also to do your part, exercise that responsibility. And I want to end my presentation by saying I went last week and I took my booster shot. I am hoping to take some vacation in the near future and probably travel, and I want to be protected. So I want to encourage you to go and tell family, friends, and everyone. Again, we saw that Dr. Wilkinson made the clarion call for 142, then 47 more. We reach it. So let's continue to see if we could reach 100%. So let's continue the clarion call for vaccination, and more vaccination. And some questions have come to us about the taking of temperatures. Does this mean that we're not going to take temperatures anymore? We're not going to sanitize anymore? We shouldn't take names anymore, etc. The non-pharmaceutical measures will remain in place. If you have any questions or concerns, please feel free to contact the task force, the Ministry of Health, for any further queries regarding the procedures and protocol. Because when the compliance officers come around and they don't see that they see that you're not compliant with what the regulation says, you might be ticketed or you might be summoned or basically taken before a magistrate. So do your best to avoid that. Before you take action, consult and let the task force guide you, and Ministry of Health guide you, the security forces guide you as to what you can do and cannot do in the context of COVID-19. So thank you very much, everyone. I want to wish everyone a happy remainder of this week. We are into the best month of the year, December. I'm a December born, so it's the best month to celebrate. Thank you very much.
Thank you very much, Mr. Samuel. I guess, you know, we can all say the same. Our month is the best month. And to say that you're boosted up, I'm boosted up too. So quite a number of us here are boosted up. Superintendent Cromwell Henry, Dr. Cameron Wilkinson, Mr. Samuel, myself, we were all boosted up. I don't know if anyone else is boosted up here, but the intention is to be. We have come to the question and answer segment of our briefing, and the first two questions are from Von Radio. With the emergence of this new variant, Omicron, in first world countries, are we already seeing its impact on the distribution of food supplies to small island nations such as St. Kitts and Nevis? And the second question, some persons are complaining about not receiving their vaccination cards month after month. After receiving their second dose of the vaccine, can this be explained?
Good evening, everyone. I will attempt to answer the first question. I think it is in reference to the intended or expected supply chain interruptions that we have seen, where persons are now questioning whether we are beginning to see the effects here in terms of the local food stock. I have not seen that as the Minister of International Trade. I know some persons have said that as they move around to certain shops in the various communities, you might see bare shelves, but that is not necessarily an indication that the supply chain global interruptions that are taking place are beginning to have an impact here in St. Kitts and Nevis. It could simply be a matter of dysfunction that might be experienced by the store owners in terms of stocking and restocking of shelves as well as their own warehousing capacity. However, while we are on the subject of that, Leslie, I should indicate, as I would have done during the Prime Minister's last press conference, that the Ministry of International Trade is committed to working closely with all of the food importers. Up to today, I would have had a conversation with the Financial Secretary on the matter. There are several options that we have in front of us once we put that multi-stakeholder group, inclusive of customs, the Chamber of Commerce, small business interests, etc., as well as general wholesalers, as to the best way forward. A number of countries have looked at certain options, including easement at the port, insofar as using historic data for the port charges that would have been accrued prior to the impact created by supply chain problems. So that is one mechanism, but we will look at it closely and carefully, because whatever we do, even if we are to come up with any type of relief, we want that relief to get to the consumer. And we want it to be able to be demonstrated that way. But as it is right now, there is no evidence that we can tell that we are beginning to see that type of impact here on us. Yes, it is true, St. Kitts and Nevis is a net importer of food, and it begs the question all over again. Now that we have all of this arable land available to us since the closure of the sugar industry in 2005, shouldn't we be making better use of it in terms of growing more of what we consume, and therefore increase our food security quotient as it relates to being sure of where your food comes from, and at the same time, going back to the age-old practice of backyard gardening, simple types of products that you don't need to go to the supermarket to buy, including your bananas, herbs, thymes, other small crops, tomatoes, greens, etc. These are things that people can plant, even in a flower pot if you don't have a backyard. So we will be working closely with the Department of Agriculture, as well as Finance, Ministry of Health, Ministry of Trade, etc., because what we want is a more coordinated response to what might be a problem for us down the road, but at the moment, we cannot say that that is the case.
So, Mr. Williams, I'm not aware that there's a problem regarding the signing of vaccine cards. So once you're fully vaccinated, your card is being signed by the DMO, the district medical officer, and you're asked to come back and collect. So probably the individuals didn't go back and collect, but I'm not aware of there being a problem. Thanks.
Thank you, Minister Phipps and CMO. These are our last questions for today. Now that we have reached the 80% threshold in terms of vaccination, do return nationals still have to quarantine for 24 hours. I think it is worth repeating because I have received a number of the very same things coming out of some things that were said today. Residents who will be in home quarantine and own a vehicle, can they drive themselves to do the COVID test? And those are the last questions.
All right. Okay, let me just begin by stating inbound travelers to the Federation of St. Kitts and Nevis, if you are fully vaccinated, you have to submit a negative RT-PCR test done within 72 hours of traveling to the Federation. Once you land, you go into quarantine, it's 24 hours. At present, persons are getting their samples done and their results well within that 24-hour period, and then once your result is negative, you're free to integrate into the society. So that's the protocol that's in vogue right now. So yes, if you're fully vaccinated, you come in, you get your RT-PCR test done within that 24-hour window. Once your result comes back negative, you're free to integrate into the society. And this measure will remain in place for at least another week or two until we gather more information regarding the Omicron variant. And then those who are in pre-approved home quarantine, basically, I think you're still required to take a COVID-19 certified vehicle to either of the venues, Pogson, Mary Charles, JNF, to get your sample taken.
Thank you, Dr. Laws. That brings us to the end of our question and answer segment for today. Oh, there was another question. Okay. Could you please ask the CMO if I am fully vaccinated with the J&J, Johnson & Johnson, could I still get the Pfizer booster?
And so the short answer is yes. So if you receive the Johnson & Johnson vaccine overseas, because we do not offer it here, yes, you can go to any of the health. If you received it over 6 months ago, yes, you can go to any of the nearby health centers and you can access the Pfizer-BioNTech booster. So actually, if you receive any of the WHO approved COVID-19 vaccines and your primary vaccination series have gone 6 months, you can come forward and access the booster shot, which is the Pfizer-BioNTech. That is if you're 18 years and over.
Okay, thank you very much, Dr. Laws, and that's the final. Thank you very much. I want to thank Superintendent Cromwell Henry for his presentation. We thank our Medical Chief of Staff, Dr. Cameron Wilkinson, who is an advocate, a very big advocate for vaccination, but of course all the COVID-19 protocols on a whole, because he understands as a doctor that the effectiveness of these measures. And Dr. Hazel Laws, who our Chief Medical Officer, who continues to work very hard in terms of the management of the COVID-19 pandemic. We also thank Mr. Abdias Samuel, our head, our chair of the National COVID-19 Task Force. Some people may not know, but the National COVID-19 Task Force, which is made up of over probably 20 persons, we have been meeting at one point when the pandemic started here in the Federation. We met every day. We met daily. Now we meet once a week, and sometimes even more than once a week as maybe necessary. And so therefore there are people who are working extremely hard on the task force. The task force is working extremely hard in trying to help with the management of the COVID-19 pandemic. Of course, we are only one body, but of course, all of us, we are in this together, and we have to do our part with the management of the pandemic as well. I want to thank Mrs. Christmas Jacobs for her dedicated service of sign language. I thank the Honorable Wendy Phipps. I didn't think she was going to come here today. And the reason why I said that is because she spent all of today in the National Assembly. So when I saw her turn up, I was like, Minister, aren't you tired? Can't you take a break? And so we thank her very much because she is unfailing in her attendance at these briefings. We thank Ms. Ophelia Blanchard, and we also thank the PRO of NEMA, Michelle Rodriguez. I understand that Vesta Southwell is now officially retired, and so Ms. Rodriguez is now at the helm. We thank Vesta Southwell very much. She has been dedicated here to NEMA and a very good sport. We get along very well together. And we thank ZIZ, AJ, and all those who come here on a weekly basis to bring you these briefings live, both on radio, television, and also it is streamed on social media. So we thank you very much. And all the media in the Federation. The media's role is extremely important in bringing information to people. It is not just about entertainment of people, but bringing credible information to the public. Because without information, really, people are in blindness, are in darkness, so to speak. And so information is important. We have to shine a light in the darkness, and that is what information does. It helps people to be more aware of what is happening so that they can know how to act. How to act. And so thank you to the media, and thank you to all of you for joining us for these briefings on a weekly basis. Next week, we will be back with another COVID-19 briefing. Until then, take good care. I am Lesroy Williams.
They had it, folks, another edition of the COVID-19 briefing here on WIN FM 90.9. Up next, we have the WIN FM News and Sports package.
You found the sound.